From reduced firmness and size changes to skin elasticity, these natural signs of aging can cause concern. But what if I told you there are ways to manage these changes and maintain a fulfilling and active sex life, even at the age of 70 or beyond? In this video, we will explore practical and effective solutions that can help you strengthen your erections, improve your intimate health, and preserve your vitality. You won't want to miss this. Stay tuned until the end to receive advice that will boost your confidence and support your overall well-being. If you haven't subscribed yet, please subscribe and activate the notification bell so you don't miss any videos. Your support means a lot to me. And if you enjoyed this video, you can help me continue sharing these valuable lessons by liking and sharing it. First change, excess skin. Over time, especially after the age of 70, our bodies undergo natural changes that inevitably remind us that time is passing. One of the most noticeable and often unsettling changes is the excess skin that can appear on the penis. This phenomenon occurs because the skin loses elasticity over the years and can no longer snap back as effectively to return to its original state. What was once tight skin gradually becomes looser, a process attributed to the progressive reduction of essential substances like collagen and elastin, which ensure the skin's firmness and elasticity. This is an inevitable aspect of aging, but should not be viewed negatively. This can surprise some men, causing worry or even discomfort about the appearance of their penis, as this loose skin may resemble the beginning of phimosis, a condition where the foreskin cannot retract properly. However, it is crucial to understand that this change is not related to a disease or medical condition like phimosis. It is simply the effect of time on our bodies, a part of the natural aging process. This phenomenon is not limited to the penis. The skin on the face, neck, hands, and other body parts also loses firmness and elasticity with age. However, the change in the penis can be more noticeable since this area, once tighter, gradually sags with age. For some men, this transformation can cause discomfort or even frustration, especially when their body no longer matches the appearance of their youth. However, it is essential to remember that this development is an integral part of our life journey. The body goes through various phases, each of which is a stage to be accepted. This does not mean the end of our masculinity, our ability to fully enjoy our sexuality or our intimate relationships. Even though this loss of skin firmness generally does not impair sexual function or the ability to achieve erections, enhanced hygienic care may be necessary to prevent irritation or discomfort. If this aesthetic change becomes burdensome, there are solutions to improve skin elasticity, such as special creams and treatments that can provide relief. However, many men must learn to accept this change to reconcile with their bodies and understand that they are undergoing new phases of learning and acceptance each day. Aging should not be viewed as a decline, but as a journey where we learn to love and respect our bodies at every stage. In this sense, I invite those who wish to maintain a fulfilling and meaningful intimate life in old age to explore the ebook Rediscovering Intimacy: Healthy Sexuality After 60 Years. This guide is full of practical advice to rekindle passion, improve relationships, and overcome the emotional and physical challenges of aging. It is a true invitation to rediscover pleasure and nurture deep connections with our partners. If you are ready to transform your love life and embrace these changes with wisdom, you can obtain your copy by clicking the link in the pinned comment. Don't let time take you away from what you most deserve: a fulfilling love life at any age. Second change, loss of elasticity. Over time, our bodies undergo a series of natural changes, and one of the most notable is how the skin of the penis loses its former elasticity and firmness. This phenomenon is primarily due to the decrease of essential substances like collagen and elastin, which are responsible for the smoothness and tone of the skin. In our youth, the skin of the penis stretches easily, adapts to our needs, and remains taut during an erection. But over the years, this ability to retract and return to its original state becomes less pronounced. Even if erections continue to occur, the firmness that was present in youth may no longer be as noticeable. This can be a disturbing change for some men, causing discomfort or concern about this transformation. To the touch, the skin may feel looser, and visually, the penis may appear less firm than before, especially during an erection. However, it is essential to emphasize that these changes, although aesthetic, do not impair a man's sexual function in any way. Erections remain possible, and while the stiffness may no longer be the same as before, they are not impaired. This process affects not only the skin, but also the internal tissue of the penis, which also loses elasticity over the years. As a result, the initial stiffness of the penis is no longer as pronounced as in youth. However, this does not mean that a fulfilling sex life is impossible. It is a normal change that many men experience, but can sometimes cause concern or even embarrassment. These transformations can somewhat diminish some men's confidence, but it is important to remember that this phenomenon is a natural part of aging that everyone experiences in one way or another. Even at rest, you may notice that the skin of the penis is more relaxed, and the sense of tension that was previously present is no longer as pronounced. However, these changes should not be viewed as a loss of masculinity or sexuality. They're simply part of what we become. This does not mean the end of our pleasure or our intimate relationships. On the contrary, it invites a new form of acceptance and understanding of our bodies in old age. For those who feel the need to improve skin elasticity, there are several options, such as specially formulated creams to stimulate collagen or tailored therapeutic treatments. These solutions can provide a certain level of comfort and well-being. However, many men choose, as they mature, to accept these changes as an integral part of the beauty of aging and the natural development of their bodies. Each phase of life brings new perspectives, and these changes can be positively experienced by recognizing that the experience and wisdom accumulated over time are far more valuable than youth itself. Ultimately, if this development affects you and you wish to reconnect with your sexuality, remember that you can always rekindle passion and intimacy with tailored advice for men over 60 years old. There are solutions to maintain a meaningful and enjoyable love life regardless of age. Aging is a natural phase, and accepting these transformations can pave the way to new well-being and serenity. Third change, reduction in size and thickness. Over time, it is entirely normal for many men to notice changes in the appearance and size of their penis. This phenomenon, which can sometimes cause concern, is an integral part of aging. In old age, one of the main factors contributing to this change is a decrease in blood circulation. Over the years, blood flow to the penis becomes less effective, leading to a reduction in the size and width of the penis, especially during an erection. This occurs mainly due to the accumulation of fat and plaques in the artery walls, which reduces their ability to expand and decreases blood circulation. With less effective blood flow, erections may appear less full and less firm. This gives the impression that the penis has lost size and thickness, which can be hard for some men to accept. However, it is essential to understand that these changes are natural and do not necessarily indicate a serious medical problem. The decrease in firmness and thickness of the penis is a consequence of aging and not a sign of declining masculinity. Another important factor is that the tissue, such as the corpora cavernosa, which enables the penis to become erect by filling with blood, no longer stretches as well as before. These tissues, which normally fill with blood to ensure a firm erection, do so less effectively due to reduced blood circulation. This can contribute to a feeling of less firmness and thickness during erections, affecting the perception of penis size. Although this can be concerning, it is important to remember that this development is part of the natural life cycle. Aging should not be seen as a burden, but as a normal process that encourages us to appreciate other aspects of our well-being. There are ways to mitigate the effects of decreased blood circulation and maintain overall health. A healthy and balanced lifestyle is crucial to minimizing these effects. A diet rich in fruits, vegetables, whole grains, and foods that promote good circulation is an excellent starting point. These foods can improve artery health and help maintain optimal blood flow. Additionally, regular physical activity, especially cardiovascular activities like brisk walking, swimming, or running, plays a crucial role in maintaining healthy circulation. These activities strengthen the heart, improving the body's ability to pump blood efficiently. Moreover, it is important to avoid harmful behaviors such as excessive tobacco and alcohol consumption. In particular, tobacco is a foe of circulation and can worsen the situation by further reducing blood flow efficiency. Alcohol can also negatively affect circulation and contribute to the feeling of reduced penis size and firmness. It is also essential to maintain a positive attitude toward age-related changes. Instead of focusing on what is lost with age, it is crucial to celebrate what is gained: wisdom, experience, and greater serenity. By accepting these transformations and actively maintaining our health, we can continue to lead a fulfilling life, both physically and in relationships. Ultimately, it is not the size or firmness that matters, but the quality of the connection and shared pleasure with a partner. Fourth change, less visible penis. As you age, it is common for the body to undergo various changes that, while natural, can be disturbing for some men. One such change is the phenomenon of the hidden penis. This term describes a condition where the penis appears retracted or less visible at rest. This phenomenon is mainly due to the accumulation of fat in the pubic area and the loosening of the scrotal skin, two effects that become more pronounced over time. With advancing age, body fat tends to redistribute, and the area above the penis is not spared. This gradual accumulation forms a fat layer around the pubic area, making the penis less noticeable and appears smaller at rest. This change can be particularly frustrating for some men, as it alters the external appearance in a way that no longer matches their youth. Additionally, the skin of the scrotum also loses firmness. This loosening of the skin leads to a sagging scrotum, which enhances the feeling of the penis being retracted and makes it even less visible. This combination of fat accumulation in the pubic area and loosening of the scrotal skin often gives the impression that the penis has shrunk or is less prominent. For many, this change can cause discomfort or even diminish self-confidence. However, it is important to understand that this phenomenon is entirely natural and part of the aging process. This does not mean that sexual function is impaired, but merely that the appearance can change over time. For those disturbed by this aesthetic change, fortunately, there are solutions. Aesthetic surgeries like liposuction in the pubic area can be an option to remove excess fat and give the penis a more visible and natural appearance. This type of procedure can be particularly beneficial for men who wish to restore their body image and feel more comfortable in their skin. Additionally, there are treatments to improve the firmness of the scrotal skin. These procedures, often non-invasive, are designed to tighten the skin and restore some elasticity, helping to lift the scrotum and reduce the retracted appearance of the penis. While these treatments are available, it is also important to remember that many men choose to accept these changes as part of the natural aging process. Self-acceptance and embracing one's body over the years are essential aspects of well-being. Aging is not a decline, but an enrichment, and each life phase brings new ways to connect with oneself and others. Ultimately, it is essential to recognize that our value lies not only in our appearance, but in how we face life's challenges with wisdom, serenity, and confidence. Fifth change, calcification of the penis. Over the years, our bodies undergo natural changes, and one of the most notable in older men is penile calcification, a condition that can impair the flexibility and function of the penis. This phenomenon is often associated with Peyronie's disease, a condition where hardened plaques made of scar tissue develop within the penis, primarily in the corpora cavernosa. These structures are essential for erection, as they fill with blood and enable the penis to become stiff during arousal. When these plaques form due to chronic inflammation, they alter this essential function. As inflammation progresses, calcium deposits and scar tissue formation lead to hard areas within the corpora cavernosa. These hardened plaques create rigid zones that restrict the penis's ability to expand normally during an erection. This phenomenon can be particularly disturbing as it reduces the flexibility and smoothness of the penis, making erections appear less natural and sometimes less full. In many cases, these plaques can also lead to a curvature of the penis, especially during intercourse or erections, which can be uncomfortable or even painful for some men. This curvature is not only an aesthetic issue. It can cause pain, impair self-confidence, and even disrupt sex life. Penile calcification limits the expansion of the corpora cavernosa, preventing a full erection and leading to penile deformities that can be frustrating. Besides Peyronie's disease, there are several other factors that can promote penile calcification. Repeated trauma, such as minor injuries from intense physical activities or excessive pressure during intercourse, can also contribute to scar tissue formation, which over time hardens into calcium-rich plaques. These minor injuries, often initially ignored, can accumulate and lead to more serious pathology if left untreated. Men suffering from penile calcification should consult a doctor at the first signs. It is important not to ignore these symptoms, as there are treatments that can help alleviate the condition and improve quality of life. Treatment for Peyronie's disease depends on the severity of the condition. In milder cases, medications may be prescribed to reduce inflammation and improve tissue flexibility. These medications help relieve pain and decrease the formation of new plaques. In more severe cases, when plaques are well formed and penile curvature is pronounced, surgical intervention may be necessary. This surgery can aim to remove the calcium-rich plaques and correct the curvature, thereby improving erectile function and restoring the penis's natural shape. It is essential that men experiencing this issue do not feel alone or ashamed. Peyronie's disease and penile calcification are common conditions, especially in old age, and effective treatment options are available. Taking care of one's sexual health and consulting a specialist in a timely manner can make a significant difference, not only in terms of physical relief, but also in regaining confidence and maintaining a fulfilling intimate life. Sixth change, reduction in natural lubrication. As men age, many notice that their penis no longer stays as hydrated as it used to. The skin, once smooth and well-nourished, gradually begins to dry out as the natural production of substances that maintain hydration and elasticity decreases. This dryness is an inevitable consequence of aging, as the skin loses its ability to retain water, affecting texture and comfort. Consequently, the penis can feel drier, especially during intercourse, making the experience less enjoyable. This lack of hydration can cause several inconveniences. Firstly, the friction caused by the lack of lubrication can lead to irritation and discomfort. Less moist and drier skin can also impair the flexibility of the penis, making natural movements more difficult and reducing the fluidity of relationships. Additionally, this dryness can affect the erection, as less elastic skin can hinder the penis's ability to move freely, making the intimate experience less satisfying for both partners. While this issue is a normal consequence of aging, it should not be ignored. Fortunately, there are simple and effective solutions to restore comfort and improve the quality of relationships. One of the best options is to use lubricants. Water-based lubricants are especially recommended as they are gentle, non-irritating, and help reduce friction. They enhance comfort and the fluidity of relationships while protecting the skin from irritation. These lubricants are also compatible with condoms, making them practical for safety-conscious men. Another option to address dryness is the use of specific moisturizing creams for the intimate area. These products are formulated to restore moisture and soothe dry skin. They help maintain the skin's natural balance while providing targeted hydration. It is important to choose products that are gentle and free from fragrances or irritating substances to avoid additional discomfort. Specially developed moisturizing creams for the intimate area can also improve skin smoothness and prevent dryness in the long term. Accepting these age-related changes is an important part of aging, but that doesn't mean you have to sacrifice comfort and pleasure. By taking care of the skin and using the right products, it is possible to enjoy a fulfilling and pleasant intimate life, even in old age. These small steps can make a significant difference by bringing both comfort and confidence, allowing everyone to continue living their sexuality fully without embarrassment or frustration. Seventh change, appearance of spots. As men age, it is entirely normal for the skin of the penis, like all other body parts, to undergo changes. The appearance of spots and color deviations is one of the natural manifestations of aging. These markings result from the adjustments that occur in the skin over the years as it loses some of its regenerative capabilities. With age, the production of collagen and elastin, these essential substances that keep the skin firm, elastic, and even, declines. This reduction leads to more fragile skin that is less able to maintain its smooth and even appearance. Therefore, it is not unusual for darker spots to appear, often due to increased melanin production, or conversely, lighter areas to form as pigmentation decreases. These changes can also be accompanied by areas of thinner or drier skin. In addition to the natural effects of aging, several external factors can accelerate this phenomenon. For example, sun exposure and pollution affect skin health, although direct sun exposure on the penis is less common. Other factors like hormonal fluctuations in old age, slower blood circulation, or even internal metabolic changes can promote the formation of these spots. Over the years, the skin of the penis will also become less capable of repairing and renewing itself, increasing the visibility of imperfections and color changes. It is important to note that these spots are benign in most cases and do not pose a health risk. However, as with any skin change, it is always crucial to watch for unusual alterations. If the spots become painful, itchy, or are accompanied by redness, swelling, or other concerning signs, it is essential to consult a doctor. Although these spots are often associated with aging, they can sometimes be a sign of more serious issues like infections or skin disorders that require specialized treatment. To keep the skin of the penis healthy and minimize the appearance of these spots, it is recommended to regularly moisturize them with gentle and non-irritating products. Using moisturizers or lotions can help maintain smoother and nourished skin. It is also advisable to avoid harsh chemical products or substances that can dry out the skin or further alter its color. Protecting the skin from external factors that can accelerate aging, such as pollution, is also beneficial. By regularly applying these care products, the appearance of spots can be reduced and the overall texture of the skin can be improved, leading to a more even and healthier appearance. Ultimately, these changes are a natural part of the aging process, and while they may initially be confusing or concerning, it is important to remember that they are part of our life journey. Taking care of the skin, accepting these changes, and consulting a professional when necessary can not only improve our comfort, but also enhance our overall well-being. Eighth change, small cracks. As men age, it is common for the skin of the penis to become drier, a phenomenon that can lead to the formation of small cracks or fissures. This process is associated with the gradual loss of the skin's ability to retain moisture and maintain its natural flexibility. As men age, the production of sebum and other moisturizing substances essential for keeping the skin soft and supple decreases. Without this support, the skin becomes more brittle and susceptible to stress, making it particularly prone to cracking or fissures, especially during friction or pressure, such as during intercourse. This skin dryness can have significant physical consequences. Due to the loss of moisture, the skin becomes less elastic and resilient, making the appearance of small cracks, sometimes in the form of fine lines or visible fissures, easier. These cracks can be painful, especially when they extend or stretch during an erection or intimate contact. This type of discomfort can not only affect the quality of sexual life, but also overall well-being, as pain and irritation can reduce pleasure and create discomfort. Furthermore, these cracks, although seemingly harmless, can pose health risks. In fact, they can become entry points for germs, bacteria, or other pathogens, increasing the risk of infection. This can lead to additional complications that sometimes require medical treatment. Therefore, it is essential to take care of the skin of the penis to avoid these small injuries and prevent the risk of infections. Maintaining hydrated and healthy skin is a crucial step in preventing the appearance of cracks and other discomforts. Regularly applying appropriate moisturizing products, specifically designed for the intimate area, can significantly help. Gentle creams and lotions free from irritating substances or artificial fragrances allow you to nourish the skin and restore its elasticity. By using these care products, the skin barrier can be strengthened and the skin can be protected from excessive dryness. It is also important to avoid external factors that can dry out the skin, such as prolonged exposure to hot water or the use of harsh soaps. Adopting simple habits and good daily care can help maintain healthy, supple, and resilient skin, reducing the risk of cracks and future complications. Taking care of the skin while aging is not only a matter of appearance, but also of daily well-being and comfort. Ninth change, reduction in penis length with age. Over the years, some men may notice that their penis appears smaller compared to earlier years. This phenomenon, while entirely natural, can be concerning. It results from a combination of factors that become more pronounced over time. One of the main factors is the decrease in blood circulation in the intimate area. As men age, blood flow becomes less effective, preventing the penis from filling completely with blood during an erection. This lack of circulation can result in a less complete erection, giving the impression that the penis has shrunk. Another factor contributing to this feeling of reduced size is the accumulation of fat in the pubic area. As body weight increases, some of this fat is stored above the penis, masking a portion of its length and volume. This can create the illusion that the penis is smaller, especially in cases where significant weight gain has occurred. This is a natural consequence of aging and the way our bodies store fat, but it can affect overall appearance. Additionally, the tissues of the penis itself undergo changes over time. The internal structures that enable the penis to fill with blood and gain volume during an erection, such as the corpora cavernosa, can lose elasticity and tone. This can lead to a reduction in firmness and fullness of the penis during erections, contributing to a less voluminous appearance. These changes are part of the aging process and reflect the natural functioning of the body, which evolves over the years. Although these transformations are natural, there are ways to mitigate them and maintain good sexual health. Weight management is one of the most effective strategies to reduce fat accumulation in the pubic area. Maintaining a healthy weight and avoiding excessive weight gain can help preserve a more toned appearance and minimize the effect of the hidden penis caused by fat accumulation. Additionally, regular physical exercise, especially activities that promote good circulation, can help improve the quality of erections and maintain vascular health. Cardiovascular exercises like walking, swimming, or cycling contribute to maintaining optimal blood flow, which is essential for healthy and full erections. Furthermore, engaging in pelvic floor muscle strengthening exercises, such as Kegel exercises, can play a crucial role in maintaining erectile function. These exercises help tone the muscles responsible for controlling erections and can improve blood flow to the penis, thereby preserving its function. In combination with these physical efforts and a healthy, balanced diet, it is possible to combat some of the effects of aging and maintain a fulfilling sex life. These changes are part of the natural life cycle, but with the right health habits, it is possible to manage them and preserve an active and satisfying sexuality regardless of life stage. 10th change, reduction in sensitivity. As men age, many notice a decrease in the sensitivity of the penis, especially those suffering from chronic conditions like hypertension or diabetes. These diseases can affect both the nerves and blood circulation, two essential elements for normal and pleasurable sexual response. Hypertension, for example, can damage blood vessels, reducing blood flow to the penis and impairing the proper response to sexual stimuli. When blood does not circulate efficiently in this area, achieving a full erection and having a satisfying response to physical sensations becomes more difficult, making the experience less intense. Similarly, in diabetes, high blood sugar levels can lead to nerve damage, a condition known as diabetic neuropathy. This type of neuropathy affects the peripheral nerves and decreases sensitivity in various body parts, including the penis. When sensitivity decreases, the response to sexual stimuli weakens, making pleasure less pronounced. This can also make achieving orgasm more difficult and affect the overall quality of sexual relationships, impacting not only the sex life, but also the individual's emotional well-being. The reduction in sexual sensitivity can lead to feelings of frustration and dissatisfaction and affect self-esteem and confidence. However, it is important to understand that these effects are not irreversible and there are ways to mitigate them. Proper management of underlying health conditions, such as hypertension and diabetes, is crucial. By controlling these diseases through medication, balanced nutrition, and appropriate care, it is possible to limit their impact on sexual function. Effective management of blood pressure and blood sugar levels can reduce damage to blood vessels and nerves, thereby promoting a better response to stimuli. Additionally, it is essential to consult a healthcare professional to identify appropriate treatments, such as physical therapies, medications, or even medical devices that can help improve circulation and sensitivity. Sometimes, specific treatments may be recommended to partially restore sensitivity and optimize sexual function, including medical creams or gels that promote local blood flow. It is also important to note that while aging brings natural physical changes, there are multiple ways to take care of overall health and maintain sexual function. A healthy lifestyle can make a significant difference. Regular exercise, especially cardiovascular activities, helps improve circulation and strengthen the nervous system. A balanced diet rich in nutrients can support vascular and nerve health, while stress management helps maintain hormonal balance beneficial to sexual health. Reducing stress, which can also negatively impact circulation and nerve function, is a key factor in maintaining a long-term fulfilling sex life. Ultimately, while natural changes occur with age, there are numerous options and strategies to minimize their impact on sexual health. By taking care of your body, seeking appropriate solutions, and maintaining a healthy lifestyle, it is possible to preserve a fulfilling, intimate life and boost self-esteem at any age. Thank you for watching. We have discussed some important aspects of how aging can affect our sexual health. from reduced sensitivity to changes in circulation and skin health. What have you learned so far? Which insights or tips stood out to you the most? We would love to hear from you. Please share in the comments one thing you learned today and plan to integrate into your life in the future. It could be about managing health conditions, improving circulation, or even enhancing skincare. Your thoughts can also help others. If you enjoyed this video, please leave your comment below and don't forget to like, share, and subscribe to our YouTube channel for more insightful content. Stay healthy and take good care of yourself. We'll see you in the next video.